Hello everyone, I'm Jaime Oxales and I'll be presenting how next generation sequencing or NGS is transforming the diagnosis and treatment of acute lymphoblastic leukemia with precision medicine. In this presentation, we'll go over what acute lymphoblastic leukemia is, its complexity, and traditional diagnosis. Next, we'll introduce next generation sequencing, its novel discoveries, and future implications. Then, we'll finish things up with a quick recap. The 2020 review article by Tran and Hunger on the genomic landscape of pediatric acute lymphoblastic leukemia and precision medicine opportunities was used as a primary reference of this presentation. Acute lymphoblastic leukemia, or ALL, is the most common cancer in children, accounting for 25% of pediatric cancer diagnosis. It is characterized by the overproduction of immature lymphoid cells in the bone marrow. And although cure rates have improved significantly over the years, relapse and treatment resistance remain serious concerns. Since the normal functions of the bone marrow is hindered with the overproduction of immature lymphoid cells, the most prominent symptoms of ALL involve the decreased production of red blood cells, white blood cells, and platelets, leading to weakness and paleness, immunosuppression, and increased bleeding and bruising, respectively. Now, one of the key challenges in treating ALL is its genetic diversity. ALL is not a single disease, but a collection of subtypes with distinct genetic alterations. These include chromosomal translocations, aneuploidies, and gene mutations that impact prognosis and treatment response. Historically, diagnosis of ALL relied on karyotyping with fluorescence in situ hybridization or FISH and reverse transcription PCR or RT-PCR. While useful, these methods are limited. They detect only known abnormalities and often miss smaller or cryptic mutations known as submicroscopic lesions. Essentially, they weren't able to detect, at least effectively, novel variations, the mutations at the level of nucleotide base pairs. Now enter NGS, which allows for high throughput and efficient genomic sequencing due to its ability for massively parallel sequencing of DNA and RNA fragments. Unlike traditional methods, NGS can detect a wide range of genetic changes, point mutations, insertions, deletions, and gene fusions in a single run. This greatly improves our ability to identify all relevant alterations in a patient's leukemia condition, even those with novel characteristics. Thanks to NGS, researchers have uncovered new genomic subtypes of ALL. These discoveries not only improve diagnostic accuracy and risk predictions, but also open the door for personalized treatment. For instance, patients with Philadelphia chromosome positive ALL have a BCR ABL1 gene fusion that produces an overactive tyrosine kinase, which promote uncontrolled cell division. Accordingly, these can be effectively targeted using tyrosine kinase inhibitors or TKIs. Similarly, PH-like ALL can involve ABL class infusions that also respond to TKIs. On the other hand, PH-like ALLs with JAK-STAT pathway mutations may benefit from Janus kinase or JAK inhibitors, offering a more tailored approach to treatment based on the genetic profile of the disease. NGS findings are now guiding treatment decisions. By matching specific mutations with targeted drugs, clinicians can personalize therapy. This is already happening in clinical trials, with drugs like dasatinib being tested for ABL class subtypes and ruxolitinib for JAK-STAT mutation subtypes. Looking forward, challenges remain while aiming to integrate NGS into routine clinical care. These include managing data complexity and ensuring access in low resource settings. Nevertheless, with continued research and clinical trials, precision medicine is becoming a reality for more patients, including its potential for universal genomic screening to guide treatment of newly diagnosed patients. To sum up, NGS has transformed our understanding of ALL by uncovering its genomic complexity, enabling more precise treatment strategies. And as technology continues to advance, so too does our potential to improve outcomes for patients with this disease.